states that have had substantially increased outbreaks in the last couple of weeks, many of their public health officials attribute that to Memorial Day weekend, congregations, get-togethers, parties, and behavior. This is so important that while we want to celebrate our nation's birthday, or in our case, our daughter's birthday in addition to our nation's birthday, that we do it in a safe way. And that means, please, to the extent you can, make plans to celebrate 4th of July with your family, or perhaps with one other family. The real danger is that there is large parties, get-togethers, events, 50, 100, 200 people, could even be barbecues, and it might be what you do traditionally for 4th of July. Maybe you traditionally get together with extended family and second cousins and neighbors and have a block party. This is not the year to do that. We want to celebrate our nation's birthday in a safe way. The founding fathers would have wanted us to celebrate it in a safe way. They wouldn't want us to put our parents and grandparents and our cousins and our families at risk over contracting a deadly virus. If there's fireworks in your area, you can watch them in a dispersed way. Many shows are going on. There might be some that canceled, but not in don't watch them in a centralized location. I mean, that's a great thing about fireworks. You can sort of set up with your family and hopefully be 20 feet apart from other families, right? And if you want to be with one other family group with yours that you're close to, that's a reasonably safe way to do it. Outside, social distancing. We don't want our 4th of July holiday in Colorado to be what Memorial Day weekend was in Arizona and Florida and lead to a renewed round of 20 times the level of virus, where you get to the point where it could be overwhelming our healthcare facilities. Right now, the trend is good in our state. There's a slight uptick. We're watching it closely. That's why we brought Dr. Rachel Herlihy to give you an update on coronavirus and where we are in Colorado. But really, it's incredibly important when you plan July 4th, if your friends and your family are asking, be part of a big event, just say no and just say, look, we'll do that next year. This year, let's do it in small groups, or let's all enjoy it with our own nuclear family, or maybe with one set of friends. And do that in a way that's safe and further apart from others. We really don't want the celebration of our nation's birthday to be a setback for our economy, a setback for our health, and something that could jeopardize your life or the life of your loved ones. Our progress in Colorado is testament to the people of our state continuing to wear masks, keep distance whenever possible, and all of the additional protections around many of our older Coloradans who are still staying at home whenever they can, like my parents, and of course exercising good judgment. Now we are starting to see, new outbreaks in different parts of the state. In the San Luis Valley, El Paso County, Boulder County, San Miguel County. We're also watching Eagle County very closely. We are closely monitoring these local spikes, because any one of these outbreaks could lead to a community-wide outbreak, but they also serve as a reminder to the public that all of our gains could be reversed very quickly if we're not careful and wear masks and stay 6 feet apart from others where we can. Really, the best advice is, as you're interacting with people, whether they're neighbors, friends, or you're going to the store, just act as if everybody might have coronavirus, because in fact, and be contagious, because some of them might be contagious without even knowing it. If we take those precautions with everybody, and that means wearing a mask and being 6 feet where possible, the outdoors interactions being safer than indoor interactions, if we're just cautious and just say, you know what, anybody I come in contact with might be contagious, therefore I'm going to be smart about it, I'm going to wear a mask, I'm going to be 6 feet away when we're talking, that will help us continue the tremendous gains that we've had in Colorado against this virus. We're only a couple steps ahead of this virus. It can easily jump back. It is the same exact virus that killed tens of thousands of people in New York and is now spiking in Arizona and Florida. And it's really just a function of not giving it a foothold here by being smart about it, wearing masks in public and staying 6 feet apart from others. I'm going to introduce our top epidemiologist for the state, Dr. Rachel Herlihy. She's going to take you into the numbers and provide some context about where we are in the fight against the virus here in Colorado, including some of the latest information. Dr. Herlihy?
Good afternoon. As the governor described, we've made tremendous progress here in Colorado, and I want to share with you some of the epi data that we have, epidemiologic data. If we can go to the next slide. So this figure shows you cases of COVID-19 that have occurred in Colorado by week, and you can see that we certainly have made tremendous progress since we peaked in mid to late April here in the state. We've seen a steady decline in the number of hospitalizations, number of deaths, and number of cases occurring in the state. But what I want to point you to is the week of June 7th and the week of June 14th. So if you look at the week of June 7th, that was the lowest number of cases that we observed so far here in the state. Last week, though, the week of June 14th, we saw an increase in cases here in the state. The week of June 21st is obviously incomplete in this figure and so does not represent full data. So at this point, best to not focus on this incomplete data for the last week. But what I want to talk about is the fact that in the last week we did see an increase compared to where we have been. And this is another way to represent that is by the reproductive number. We talked a lot about this term R0. It refers to the number of individuals that are infected by a single case of COVID-19. And so if in Colorado the R0 value is something like 3, that means on average 3 Coloradans are infected by a single case. And what you can see through all of our efforts, through social distancing, mask wearing, our public health work, we've been able to reduce that R value below 1. And that's where we get to a place where we can suppress this virus and limit the amount of transmission that's occurring. But what you can see in this figure, in the last few weeks, we've gotten closer and closer to 1. That value is now about 0.96, which means it's right below 1. And so we're really at a place that is a bit tenuous for us. If we continue to see this R value increase, that means that we could potentially continue to see increased transmission in the state. So as I mentioned, last week our numbers were higher than the previous week. And so because of this, the time is really critical for us to ensure that all of the strategies that we've been using to date, so mask wearing, social distancing practices really need to continue. And it's also a critical time for us to ensure that our local public health agencies have the capacity that they need to be able to investigate cases, do contact tracing work, use strategies like isolation and quarantine, and as outbreaks are identified, to quickly respond to those outbreaks and stamp them out before they get larger and spread across the state. Next slide. So I want to share a little bit of data that shows you some of our trends in age of cases over time. So as all of us know, and we've talked about quite a bit, we know that older Coloradans tend to be those that are at greatest risk of severe illness. We see the highest rates of hospitalization. We know that for those over 65, they represent about half of our hospitalizations in this state. We know that among the deaths that we've experienced in the state, 9 out of 10 have occurred in older Coloradans. And so this figure is showing you that over time, since the peak of our epidemic here in the state, we've seen an average decline in the age of cases that are occurring. And so this is a good thing, right, in that we know that older Coloradans are practicing higher levels of social distancing, they're being protected, and we're seeing this disease occurring in younger populations, which is good because we know that younger populations are less likely to have severe outcomes. But I think this also emphasizes the message that we need younger Coloradans also to be practicing high levels of social distancing and be compliant with mask wearing. As the governor mentioned, we've had a number of outbreaks in the last couple of weeks that have occurred among younger Coloradans, teens and young adults that have been gathering together for parties and in other situations, and transmission is occurring in those groups. And it's important that all Coloradans, not just those over the age of 65, practice high levels of social distancing, and that we're social distancing to not just protect older adults, but to protect ourselves as well for all ages. Next slide. And this is a figure that shows you rates of COVID-19 by state. Across the country. And as you can see here, we've been fortunate here in Colorado to continue to suppress this virus and have low levels of transmission. This data is showing you rates of transmission in states in the last 7 days. But of course, as the governor mentioned, there are a number of our neighboring states that have experienced increases in the last several weeks. And so this is really what we are working to avoid here in Colorado, continuing to use the strategies we're using to ensure that the rates here that we're experiencing emerging in Colorado. Do not go the way of some of these other states, some of our neighboring states that are now seeing high levels of transmission and widespread outbreaks of disease. And that is everything I have for you today. Thank you.
So, it's encouraging news that that there's less transmission among our older Coloradans. I think that's partially due to the extraordinary measures around testing some of the workers in our senior care and congregate care facilities. It also shows the success of older Coloradans in increasing their own social distancing. But, it's important that 20-somethings also recognize that this is a significant virus for people of their age as well. For people that are in their 70s, almost half will need to be hospitalized who contract this virus. For people in their 20s, it's still about 1 in 15 to 1 in 20 that need to be hospitalized. So, just, imagine if you're 20-something and you have a group of 20 friends, they all get it, likely 1 or 2 will have to be hospitalized. That's how bad it is. It's hard to, when you think you're going to knock out an invulnerable 24-year-old who's incredibly healthy, but they still have, 1 in 15, 1 in 20 chance of having to be hospitalized if they contract this. Obviously lower than people in their 60s, 70s, and 80s, but it shows the severity of this for people of all ages. This is not something to be trifled with. And I think it's important that as we prepare for July 4th, that all Coloradans make plans to celebrate our nation's birthday in a safe way. And just ask themselves, simple common sense questions. How many other people are participating in an activity? Is the activity outside? Is there a way in this activity we can put distance between ourselves and others? How long will the activity take? Asking yourself, do you feel 100% healthy? For Coloradans who, normally would go out with what they think is a minor cold, don't go out. The virus often starts with minor symptoms and gets worse over time. Get tested. There's 48 free testing sites across the state, covid19.colorado.gov. You can check them out. For the Denver metro area, the Pepsi Center, easy to access. You'll be done in 15 minutes. You pull up in your car, and it's incredibly easy. And of course, a lot of Coloradans will also be asking themselves the questions, do I live with someone who's more vulnerable to COVID-19? So if you're a 20-something, living with your parents in their 60s, that's a very important question to ask, right? Very important question to ask, because you might say, you know what, if it's a 1 in 20 chance of me going to the hospital, I'm willing to take it to party with my friends. But are you also willing to have that 1 in 3 chance that your parents would have to be hospitalized if they contract that? So we need to think about our loved ones, particularly if you live with our caretaker for older Coloradans. So it's a time to exercise personal responsibility. That's really what will determine the course of the virus in Colorado. So far, Coloradans are doing a good job wearing masks, being 6 feet apart from others where we can. We just need to keep it up. And I encourage you to visit covid19.colorado.gov/risk-benefits. That gives you more information about high, low, and medium risk activities. Just if you're wondering, it's largely common sense. It has to do with proximity. Are you indoors or outdoors? How long are you together with people with? But if you want more scientific information, please go to that website. And if you want to, it's a great time to enjoy Colorado's great outdoors. And we need to do our part to be responsible. Earlier this month, the Colorado Tourism Office released a new animated video as part of our comprehensive initiative that promotes our take on responsible travel, responsible tourism. That means within our own state as well as visitors to our state. So here we're speaking mostly to Coloradans. There might be a few people watching this thinking of coming to Colorado. Hello, please come here safely and wear a mask while you're here. But for Coloradans that want to travel to other areas of our state, we want to be responsible. And, we want to introduce this video that we have put out and are pushing out about responsible tourism in our state. Here's the video.
When visiting us in Colorado, here's a few things you should know. 5 steps will help protect us all, no matter where you go. Space! How about a ski between you and me? Mask! Keep one in your pocket in case you need to rock it. Clean! Wash your hands and be careful what you touch. Stay! Feeling sick, stay home, protect others, thanks a bunch. No! Follow the guidelines wherever you go. Stay up to date and in the know. These 5 steps are just a start to help us all do our part. Thanks for listening to our tips. We hope you all enjoy your trips.
And it's really important that folks who are coming to Colorado, that are an important part of our economy, our quality of life, really respect their own health, respect the health of locals. They may be coming from areas that don't have the same mask-wearing culture, that don't have the same emphasis on social distancing, that might be experiencing outbreaks. Well, when you come to Colorado, we want to make sure that you're safe. You're our guest, and being our guest includes certain responsibilities. And I want to highlight a local best practice, one that I want to encourage other counties that are receiving tourists from replicating or expanding upon. Eagle County, of course, home to world-class ski resorts like Vail and beautiful mountain areas, Gypsum, Eagle, many others. Eagle County's Public Health Department asked every hotel and short-term lodging facility, that's like Airbnb or VRBO, to give a letter to guests upon booking that gives them the critical health information. They ask all travelers to follow the 5 commitments of containment when they're in Eagle County, to commit to maintaining 6 feet of physical distance, to washing their hands often, to wearing a facial covering mask when they're in public, to stay home if they're sick, and to get tested immediately if they have symptoms. And I want to thank Eagle County for going above and beyond and trying to find this balance about how we can host tourists in a safe as possible way, and one that encourages that responsibility that Coloradans have been showing among our guests as well. And I want to thank the hotel and lodging industry for doing their part to promote responsible tourism. The more that we can ensure people are following the proper public health guidelines, the better chance we have of avoiding increases of COVID-19 in Colorado, or another wave of devastating economic impact. Obviously, if we were a hotspot, tourists wouldn't even be coming here. So there's a real vested interest of tourism and recreation and lodging to say, how do we follow health guidelines, make sure our guests do, so that we don't start having an outbreak here that then deters guests for weeks or months to come. And that's incredibly important. We welcome Coloradans to visit other parts of the state responsibly. We welcome others to visit Colorado responsibly. And we just want to make sure that when you are our guest, that you act responsibly, wear a mask in public, stay 6 feet from others, and follow these simple guidelines. I also want to provide an update on visitation to our seniors, our residents, and congregate care facilities. We know how deadly this virus is inside nursing homes, and that's why senior care facilities, nursing homes across our state are taking steps successfully, by the way, when you see the age reduction, when you see the less deaths among our seniors, to reduce the risk of workers bringing the virus in and of the virus spreading in our senior homes and care facilities. Now, these steps are necessary to protect our most vulnerable, but we also need to recognize that it's a very difficult time for many of our older Coloradans because of mental and behavioral health challenges, because their loved ones are only able to visit them in very limited ways. Now, with the warm weather of summer, we have a unique opportunity to help seniors stay connected with loved ones. So I'm very thrilled today to announce that we are going forward. We are taking steps to facilitate outdoor visitation at residential care facilities. That's like long-term care facilities, skilled nursing facilities, assisted living facilities, intermediate care facilities, group homes, and independent living centers. This full guidance is available to the media and the public, but some of the main aspects are the facility must be scheduled a visit. Prior to the visit, they need to provide information on COVID and instructions and self-screening. The visitor is greeted outside at a designated entry. The staff member performs a temperature check and symptom screening, and the visitor wears a mask, and then they can engage in visitation with the resident. All staff and residents also wear surgical masks or higher quality masks or cloth masks whenever possible. And we are also continuing to implement the Lifeline Pass program that will allow for people who test negative to do indoor visitation. But the outdoor one is even easier to implement. It does not require a test. It just requires a temperature screening. And this provides a way that for those who are watching this, who are in your 70s and 80s, who live in one of these centers, yes, finally, your loved ones, your grandchildren, your great-grandchildren, your nieces, nephews, they can visit you outside, and we're going to encourage facilities to allow for that. Obviously, every facility has their own policy, and some are more restrictive than others. But we really believe it's an important part of your physical, mental, spiritual well-being to be able to connect with people, and we want to make sure you're able to do that in as reasonably safe a way as possible. And to those who want to visit your loved ones, you can do it outside, and then soon with the Lifeline Pass program, you'll be able to do that in a limited way inside. That requires a little bit more work ahead of time to get tested. But these are both very important because this is all about sustainability. Our 70 and 80-somethings have made great sacrifices, staying at home if they live at home, not going out, not taking visitors if they live in senior centers and nursing homes. And we need to make this sustainable because this is the way we're going to need to live the next few months. And we know that you want to see your loved ones, and they really want to see you. We also want to make sure that you're there for the future and get to see the grandkids and great-grandkids grow up and graduate high school and get married, and that you're able to be an important part of our lives for many years to come. This is part of the learning curve of how to live with COVID-19 until there's a cure or vaccine. We want to give our older Coloradans and their loved ones the psychological lift of being able to be with one another and sustain a way of doing it in a reasonably safe way so that we don't see that age jump back up and the deaths jump back up and the hospitalizations jump back up. And this is just the first step. We know everyone can't go outdoors, and that's why we're continuing to work with scientists and stakeholders to set up the Lifeline Pass program. I've also asked my scientists to work on protocols for indoor visits under development. Importantly, compassionate visitation is already allowed, still allowed. These visits have always been allowed. These are for folks at the end of their life. Facilities are encouraged to allow those visits on a case-by-case basis, palliative care, and others where they're not as worried about contracting the virus because they're in their final days or weeks or months. We want to make sure they're able to spend some of that time with their loved ones. It's a delicate balance. We want to protect our loved ones from COVID. We also want to ensure that we can have the emotional bonding and personal support that we need on all sides of the generational divide. Expanding outdoor visitation while continuing to develop these other guidances is a big step in the right direction, and we're thrilled that we're starting that here in Colorado. In conclusion, I want people to make sure that as they plan your July 4th activities, that you do it in a safe way. We don't want this to be the type of setback for us that Memorial Day festivities were in Florida and in Arizona. We can celebrate our nation's birthday. We can have fun. We can do it in a safe way. It might not look the same way that you celebrated the 4th of July last year, and it won't look the same way that we're going to get to celebrate the 4th of July next year when we have a vaccine or cure. But for this 4th of July, stay with your immediate family or one other family group. You know, if you're going to be outside and watching fireworks or enjoying barbecue, just do it with your own family or group and do it at a safe distance for others as we honor our great nation by wishing a happy birthday to the United States of America. Thank you, and we'll be happy to take some questions. Yes?
Governor, if the COVID numbers continue to escalate in places like Texas and Arizona, would you consider taking any additional steps to stop travel from those places to Colorado?
Well, Colorado is a landlocked state surrounded by a number of other states. We have tens or hundreds of thousands of folks who drive into our state or fly into our state every day, and there's no record of who they are or how they get here. That's why today we're rolling out these important tourism educational efforts. The video, as well as encouraging every county in our state that hosts tourists to take steps similar to what Eagle County has taken. To partner with bed and breakfast, VRBOs, and all forms of lodging to make sure that this information is front and center for every tourist that enters our state, and that tourists know that it is their responsibility in our state to wear masks, even if they're not accustomed to in the state they come from. It's their responsibility in our state to make sure they don't go out if they have a temperature or sick. It's their responsibility in our state to stay 6 feet apart from others whenever they can. So for Coloradans recreating in other parts of our state, as well as areas of our state that host tourists, we want to make sure that Colorado leads the way in doing this in a responsible way that's as safe as reasonably possible.
I know the focus is on July 4th right now, but school's not that far away either. And in the Hill area in Boulder, they're already seeing an increase in parties. And I know that health officials up there have been trying to find out from folks attending those parties, because they're seeing a little spike, you know, who they've been in contact with, where they've been, and aren't getting total cooperation.
Well, hopefully they're seeing a decrease in the parties now. I think the city of Boulder has taken significant measures in the past few days to make sure that normal as well as emergency ordinances around parties are enforced. That was the source of the close to 200 diagnoses, and mostly in the Hill neighborhood and around Boulder, mostly 20-somethings. So that is the kind of behavior that would lead to an increase in the virus in our state if it were to occur on a larger scale. And yes, as kids return to universities, community colleges, and colleges, it's very important that they partner with their county health departments to help make sure that they can do it in a sustainable way, in a way that keeps both their faculty and people who work at the school, as well as the students themselves, reasonably safe. Well, I think you'd have to ask Boulder County Health. I think in that case, they have seen good cooperation. They've done a lot of contact tracing. The compliance with the isolation and quarantine orders is absolutely critical. I have no reason to believe people aren't complying with those, as well as the enforcement of, not having large parties going forward. That's in the hands of the city, and they're taking that very seriously. Telephone?
Hi, Governor. It's Jessica with the Post. Given the spikes that we're seeing in Eagle and Boulder counties with that are coming from social gatherings, can the state safely move to this next phase of reopening that would, under certain circumstances, allow for larger gatherings?
So the safer at home and in the great outdoors phase is currently in effect across the state. Gatherings of up to 50 are allowed, but that doesn't mean that we're encouraging gatherings of 50. I'm very clearly, when you're celebrating 4th of July, I strongly encourage Coloradans just to do it with your family or one other family. The reason that it's up to if it's up to 50, it could lead to 2 dozen outbreak, people catching coronavirus. So we do it with your family, with others. The next phase, the protect your neighbors phase, that is not something that happens everywhere on the same date statewide. We are completing the process of finishing those guidelines, but it will occur based on the prevalence of the virus in a particular area and the strength of their public health ability to do testing and tracking and tracing. So for instance, it wouldn't occur after a spike or outbreak occurred in a particular county. They would have to get that under control, show the improvement for a week or two, and then they would be able to enter that phase. Yes.
Or Dr. Herlihy, I'm wondering if you could talk a little bit about the risks of these younger people becoming infected. Obviously, they're at a lower risk of serious complications or death, but I think you mentioned, they might live with someone who's older or, work with someone who's older or something like that.
And I'll go to Dr. Herlihy on this in a minute, but yeah, people of all ages need to take this virus seriously. The fact that it can send, 1 out of 15, 1 out of 20 perfectly healthy 23-year-olds to the hospital. There's no cold, there's no flu that does that. This is something to be taken seriously. And of course, we don't live in generational isolation, and 20-somethings have aunts and uncles and parents and older friends and colleagues. And when you have the very same disease that might send a third of people in their 60s and half of people in their 70s to the hospital, it's a far greater risk. And so it's important that we take the social distancing steps, 6 feet apart away from others, that people of all ages wear masks as we enter this next phase of containing the virus in our state. Dr. Herlihy?
Thank you. So as the governor shared, for individuals of all ages, this isn't a benign infection. We know that there can be severe outcomes in individuals who are in their 20s. And so that, I think, is something critically important for for younger Coloradans to keep in mind. And I think another important factor is that younger individuals are more likely to have asymptomatic infection, which I think reinforces the need for these gatherings to be small and for precautions to be taken, because these individuals might be present at these events and not know that they're infected with this virus. So I think it just emphasizes the fact that now is not the time to be having these large gatherings without protections in place. We really need all Coloradans of all ages to be practicing social distancing.
I mean, how more likely are folks in that younger age group to be asymptomatic? I haven't seen data on that.
Yeah, so on average, we think potentially around 40% could be asymptomatic of all ages. We know that that's probably over 50% for younger age groups.
Telephone?
Hello, Governor. This is Vinny Del Giudice of Bloomberg News in Denver. How would you rate hospital readiness in Colorado versus back in March? Are you satisfied with the timeliness of the hospital data on capacity and supplies? And is there any indication if the protests are contributing to this increase in the RT number we've seen of late? Thank you very much, sir.
So our hospitals have increased their capacity by upwards of 20% in our state since the start of this crisis. We are in a better position with regard to personal protection equipment, certainly for where we are today, if there was a slight increase. If we hit much higher levels, we don't currently have the supplies in place to handle that. We would enter another kind of crisis that would likely require reduced elective surgeries and movement of personal protection equipment into COVID wards. But that would mean if there was another outbreak. We are in the works, and we have acquired millions of personal protection equipment. We can provide another update on those numbers. There's additional masks, gloves, and gowns on the way. We would love to be able to be in a spot where we said, even if there is a major outbreak in Colorado, we have all the supplies we need. I don't think there's any state in our country that is at that point, but it is something that is a goal that we hope to reach. We don't know the cause of the recent uptick. There's some evidence that I think some of the people involved were at marches from the Boulder outbreak. We don't necessarily have that same information from Denver. We believe it was associated with large get-togethers and parties. So we don't have the direct causation of this uptick, and we hope that this is a trend that is reversed in our state. If people are redoubling their effort to wear masks and stay 6 feet apart from others, we're hoping that we can contain that recent uptick and prevent additional loss of life and disruption to our economy. Telephone?
Hi, yes, Governor. Taylor Summers from NBC News Radio. Someone referenced this a little earlier, but I'm going to be a little more specific. New York, New Jersey, and Connecticut just announced a 14-day mandatory quarantine for people coming from states with very high transmission rates of COVID-19. Alaska pulled something similar and then changed it, requiring visitors to get screened for COVID-19 before coming to the state. You discussed earlier about your concerns with rises in cases in Arizona and Utah. Would you be willing to institute a similar policy like those states, and would something like that be even feasible with those states on our border like this?
Well, look, here's how we do this in Colorado. If you work in a store or restaurant, or you're in a position where you encounter people of the public, you want to act like everybody you encounter might be contagious with coronavirus, because some of them will be, many of those without knowing it. Whether that person is from Denver or Phoenix or Tallahassee, you don't know who will be and who won't be contagious. And that's why everybody in our stores across the state is wearing masks. The people that work in restaurants are wearing masks, washing hands regularly, or wearing gloves if they're handling merchandise. I've been in a number of stores. It's great to see the precautions they put in place. In some cases, fiberglass barriers, no-touch checkouts. The people that are doing the transactions at least 6 feet apart from the customers. So we're taking these precautions from everybody. For the folks who work in tourism, in retail, it's important that we take these precautions, whether the person that you're doing business with is from Denver or Durango, or from El Paso, Texas, or from Dallas, because they could be contagious with coronavirus in any of those instances. In addition, we're strongly supportive of the steps that Eagle County has taken to help make sure that every tourist can make sure that they know what they need to do to be responsible, to be part of what makes tourism responsible in our state. And at the same time, we're releasing our education videos statewide about what it means to be a responsible tourist in Colorado. Telephone?
Yes, hi, Governor Mary Ann Goodland, Colorado Politics. How do you keep people vigilant about wearing masks and social distancing at a time when there appears to be a certain sense of, I don't know, virus fatigue setting in? And do you have a point at which you're going to have to consider greater steps? You're citing more and more outbreaks. When do you start? Is it when the R number goes above 1 that you say, okay, we got to take a step back?
Yeah, in some places in our state, there are public mask wearing requirements for residents. In other areas, it's strongly encouraged by mayors and commissioners, but not mandated. Whether it's required in your area or not, it's absolutely critical that you wear a mask when you are around others to protect yourself, protect our economy, protect your loved ones. As a state, those who encounter members of the public are being protected, and that also helps protect the public. That's why at restaurants and stores you see mask wearing. We need to embrace the mask wearing culture. Masks are a sign that we support our freedom, that we support the masks are the passport to the Colorado that we love and that we enjoy. The more that we wear masks, the more that we stay 6 feet apart from others, the more that we can return to some degree of normalcy while we coexist with this virus in a way that doesn't lead to spikes that overwhelm our hospitals and lead to unnecessary loss of life. And we'll continue to work with municipalities and counties to do everything we can in each area to make sure that people are acting responsibly, making the right choices, have the right information. At the end of the day, it's up to them, and we call upon all residents of our state to really make sure that they show that individual responsibility and make the right choices. Telephone?
Governor, it's David Clue at Denver 7. As you know, the lodging industry has suffered as much as any during this pandemic, and even with the reopening guidelines, many are telling us today they cannot survive for long, the Gaylord Rockies being one of them. When might we see an easing of those restrictions?
Well, we're not seeing tourists return to our state in the numbers that we're accustomed to. Obviously, some of these proposals like locking people in quarantine for anybody who comes here 14 days would lead to even less people coming here, or people coming here illegally without, notifying anybody. But yeah, I expect that there will be several industries that are hit hard, and we expect hospitality and tourism to be one of those, because while we are seeing visitors to our state, and Coloradans are also visiting other areas of our state, it's not even close to the numbers we normally have. So at the one hand, you have some people saying, why are we letting anybody in? Why aren't we locking people up for 14 days or testing everybody or telling people we're not open? At the other end, you have hotels saying, why can't we have, our normal level of tourism and conventions and business? The truth is it'll take a while for this economy to recover. In the meantime, everybody who comes to our state, and we want to partner with Lodging Association and hotels across our state to make sure that they implement some of those best practices that Eagle County has implemented, and make sure that the tourism that we do have to our state doesn't lead to additional setbacks that scare tourists off in a month or two and really further devastate the lodging industry. One more from the room and one more from the phone.
I think when the state started to reopen, the state's health officials talked about the idea that it was probably to be expected that there would be some kind of increase in cases. It's taken a little bit longer than I think some people anticipated, but is this increase, the spike that we saw last week, outside of what you were expecting, or and what is the tolerance? I mean, how many more cases can happen as we continue to open things up? Are we expecting this to continue?
Yeah, thank you. I'm less worried about the overall number of cases than I would be about a trend and a direction. Our goal from the very start is to make sure we don't overwhelm our hospitals and our healthcare system, and that every Coloradan who contracts COVID or who has a heart attack or stroke or any other condition gets the top level quality of care they meet. That is not currently in jeopardy at 200 people a day or 250 people a day. What is more alarming is the trend. If the trend maintains an increase over the next couple weeks, that means that this R0 value is once again above 1, and we would be able to project that our hospitals would likely be in a crisis in a matter of months. So the absolute level is less the concern than a trend over time that would ultimately lead to overwhelming our hospitals, and we want to act early on that. We want to prevent that trend from developing, and that's why we want to make sure that 4th of July plans are not a setback, that people continue to wear masks and treat this seriously, that we stay 6 feet apart from others whenever possible, small groups rather than large groups. These are the kinds of ways that we can live to prevent this trend from getting worse to the point where we see the writing on the wall around hospital capacity in a matter of weeks or months. Final telephone question?
Hi, Governor. Chris Vanderveen from 9 News. It's my understanding that you've had some communications with some local sporting teams about not just getting teams back here in Colorado and playing, but also getting fans back. Can you comment on specific plans you may have in mind that would potentially limit the amount of fans that could be in attendance at these events moving forward?
Well, I'm not sure, other than I've had many stakeholder calls, so I'm not sure specifically what conversation you're referring to. With regard to professional baseball, it has been about as the players and the teams can re-engage in activities, and I think they had the Rockies, had a minor setback with some coronavirus test conversions, which other teams will experience too. It's a challenging environment. Major League Baseball has not talked to us about fans. They have talked about players, staff, support, and televising the games. And there has not been any ask from any of the professional sports around fans being a part of that economic equation. And nor do I expect there to be, because while there's a theoretical way you could have, hundreds or even, thousands of people in very large stadiums, those stadiums can't operate like that. If they're going to staff everything up and be going, they need tens of thousands of people, and there's no foreseeable route to how there's a reasonably safe way to do that. So none of the professional or sports teams have brought up with us large numbers of fans, and I don't think that that's in the work in any city that I know of nationally. Thank you all very much. Happy 4th of July coming up. Let's be safe, and let's make sure this isn't a setback and that we honor our nation's birthday in as safe a way as reasonably possible.